Welcome, everyone. Thank you for joining us today. I'm Teresa Marantet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. Today, we are reporting an increase of 8 new cases of COVID-19 in Windsor and Essex County. Of the 8 cases, 5 are close contacts of confirmed cases, 1 is related to an outbreak, and 1 is community-acquired, and the other 1 is still being investigated. We have had 13,413 cases since the beginning of the pandemic. 12,723 cases are now resolved, and 292 people are active at this time. 37 of our cases have been identified as variants of concern, with 2 cases confirmed as the UK variant. 32 confirmed cases are currently in the hospital, and 6 people are in ICU. Our community has lost 398 people to COVID. We are reporting an additional death today. A woman in her 80s from the community has passed away. We are currently experiencing 15 active outbreaks in Windsor and Essex County, 4 in long-term care and retirement homes, 4 workplace outbreaks, 3 community outbreaks, 3 school outbreaks, and 1 hospital outbreak. The province of Ontario is launching their provincial vaccine booking system today. We ask that residents of Windsor and Essex County continue to use our local health unit pre-registration system. We are a bit ahead of other regions in the province, and as such, we will continue with our current system to vaccinate those 80 years and older. Since Thursday, February 25th, our health unit has had this online pre-registration form available for residents 80 years and older. And we've had a call center in place as well. Those who cannot access the online system should call 519-251-4072. To date, over 15,000 people over the age of 80 years of age have pre-registered. If you access the provincial system, it will direct you to our local site. And then following the pre-registration, there'll be a random selection of those who've pre-registered, and people will be called with their appointment time and day at either the WFCU Centre in Windsor or Nature Fresh Farms Recreation Centre, formerly known as the Shirk Centre in Leamington. And as of Monday, March 22nd, we will be adding 2 additional sites for those 80 years of older to get vaccinated. The St. Clair College Sportsplex and downtown Windsor at the Windsor Hall, formerly Windsor Star Building. All clinics are by appointment only, and pre-registration through this single dedicated online pre-registration form on our health unit's website is the way to pre-register for all the clinics. Our goal is to vaccinate all those 80 years and older by the end of this month. Please check in with your family and friends who are in this age group, 80 years and older, and help them pre-register if they have not already done so. To date, we have administered a total of 44,334 doses of vaccine in Windsor and Essex County. We are making significant progress in vaccinating priority populations identified in Phase 1 of the provincial government's 3-phase vaccine rollout. Between our targeted vaccine clinics in Windsor and Leamington, St. Clair Sportsplex, mobile clinics by Windsor EMS, our Essex Windsor EMS, and our health unit staff. In addition, 57 select pharmacies across Windsor and Essex County are offering AstraZeneca to adults 60 and to 64. For more information about COVID-19, please visit our vaccine webpage at wechu.org. You can also subscribe to receive email updates from the Windsor-Essex County Health Unit about COVID-19 vaccines. And despite the vaccine rollout, please continue to follow all public health measures. Stay home if you're sick, limit your close contacts, maintain a 2-meter distance from others. Wash your hands often with soap and water or use an alcohol-based hand sanitizer. Wear a non-medical mask or face covering, and cover your mouth and nose with a tissue or use the inside of your elbow when you cough or sneeze. And download the COVID Exposure Alert app at canada.ca. Thank you.
We'll now take questions from the media. Is there any questions from AM 800?
Lisa, do you know how the rollout is going at the pharmacies?
I don't have a report on the pharmacy progress quite yet, but we will be checking in with our with the province as a pilot site. We will have a meeting today and to see how things are going.
Okay, and then just with the 8 cases, obviously that's so low. We haven't seen that number in quite some time here in Windsor-Essex. Obviously a step forward, but like you always say, the virus is still out there in the community.
Exactly. That's a good number today, but we know that it can change very quickly. So people are asked to continue to be diligent with the public health measures.
Thank you.
Any questions from CTV?
Hi, good morning. I was just wondering if you could give a little bit more information on the variants of concern and what is the level of concern the health unit has about their spread in Windsor-Essex?
So the variants of concern, the guidance from the guidance from the province is very similar to the COVID without the variants of concern. All the public health measures are the same. Isolation of close contacts continues. So it's just that we know the variants can spread more quickly. And so isolating people and making sure that they are quickly identified and are in isolation to prevent the spread. So we continue to do testing and quickly follow up with people. So I wouldn't say that anything is different. It's just that we know it is in our community, can spread more rapidly, and that it's essential that we get the close contacts isolated as quickly as possible.
Thank you. Any questions from CBC?
Hi, good morning, Teresa. Last week and in previous weeks, we've been talking about potentially entering the orange zone and what it would take to get there, but last week's EPI report showed that case counts are getting worse, not better. I know we had a low case count today, but does it feel to you like we're on a bad trajectory right now? Do you think that we're likely to end up back in lockdown if the trend continues this week?
I don't really know about that. I think we will have to continue to monitor the cases, the outbreaks in our community, the variants of concern. I think there is more to going into a lockdown than just the actual number. It's also what's happening in the community transmission, and I think we just need more information. I would say that what people can do is be very aware of their distancing and their interactions and make sure they're following public health measures if we want to move forward into a better zone, an orange zone. But that's been the same case all along. So we're in mid-March. I know that last year at this time, the big concern was St. Patrick's Day and people gathering, and those will continue to be concerns. It's the gatherings, the letting our guard down. So I would just say if we all want to move together in the right direction, we all are responsible to do our part to try to decrease transmission and spread.
Thank you. I saw that the Salvation Army update was cleared. I'm wondering if there's any update on the downtown mission, whether you have an updated case count there or whether we're any closer to seeing that outbreak resolved as well.
So regarding the downtown mission, we are working with the mission on their outbreak and isolation plan, and we're working with them to make sure all of the appropriate health and safety measures are in place. Right now, to date, an approximate number is 97 staff and guests have tested positive associated with this particular outbreak at the downtown mission. Anyone that has tested positive, they're quickly moved to an isolation and recovery center and managed at that point. If possible, we identify the high-risk close contacts of the individual that's tested positive and move them to the isolation quarters as well. So it's the movement of people very quickly, as with everything, is the case and contact management for positive cases. So we will we'll continue to work with the downtown mission and, provide as much support as we can to get them reopened.
Thank you very much.
Any questions from Blackburn?
Yes, good morning. Teresa, you mentioned that you had going to have a meeting later today about the pharmacy program, but when you're giving the numbers of how many doses, does that include the ones that are given at the pharmacies?
No, that hasn't included. Oh, I'd have to check actually, because the pharmacies are using the COVAX system as well. And once you're discharged in the COVAX system, it gives you the updated number. So that's a good question. I don't believe it has included the pharmacies, but I will have to check for that for tomorrow because I'll have to check. Sorry, I don't know that. I know that Pfizer and Moderna, it might just be the Pfizer and Moderna, but that's a very good question.
Okay, no problem. I just wanted to clarify.
Yeah.
And do you have any updates, I'm not sure if you can answer this, if it's for the school board, of how the first weekend of asymptomatic testing went over the weekend?
Yes, I do have a little bit of information about the testing. It did begin, it is a Ministry of Education initiative, and that the 4 school boards have worked collaboratively with a third-party vendor, and testing did start over the weekend. We don't have any details regarding the number of staff or students that were tested, but I can tell you that we had our school nurses there on Saturday to support the school community and provide education and resources on next steps after testing. I don't have any further information though about the actual numbers or how it went.
So no update on whether or not they found positive cases and if it resulted in any cohorts being sent home?
Not related to that specific testing. I don't have any information about that, but you're right, we should hear more about the actual results of that testing. Over the weekend, we did have a couple more cohorts that have been dismissed as a result of high-risk exposures. So you'll see that on our, as the numbers are released through the school boards. And I believe there are currently 10 cohorts isolating across 8 schools and 3 school boards. So right now, I'm going to just look. There are 174 students and/or staff isolating.
Thank you.
Any questions from Windsor Star?
Yes, good morning, Teresa. With your expectation that vaccination of or first doses for the 80-plus age group that pre-registers be finished by the end of March, do you have your sights on the next age group to start pre-registering another group?
Well, we have not started pre-registration yet because we want to make sure that the 80-plus are all, pre-registered and have the opportunity. But I anticipate that the next age group would be 75 and over. And in conjunction, concurrently, we'll continue to do some mobile vaccinations at some seniors' homes, like residences or areas that have the majority of seniors living there. So we are working with the Housing Corporation and our staff and Essex Windsor EMS to also reach out to those homes. But I would say 75 plus, and then also we continue through the Sports Flex. They continue to vaccinate healthcare workers that are prioritized under the healthcare worker prioritization, and soon it will also include people with certain medical conditions. So we're working concurrently with different priorities to get everyone vaccinated based on our vaccine supply.
Do you have a sense of when pre-registration will open for the 75 plus age group or another group like the other high risk?
I don't at this time. We still have a few, like this is the 15th, so there's 3 more weeks left. And I do know that we're booking our seniors, like over 80, into March 22nd now, that week. And so once we're done, everyone will move forward. But I don't have, I can't predict. I just want to make sure we get everyone on board, but we wouldn't want to mix the pre-registration at this time.
And can you tell us how many cases are associated with the Southwest Detention Center?
I don't have that information. I'm sorry, I don't have that information. We have daily outbreak meetings, and I'll get that information today.
And I see that outbreak was declared on the 12th. Do you have any update on how management of that outbreak has been going over the weekend? Have nurses gone out there?
I don't have a report at all from the weekend regarding that particular setting. I don't have any information.
Okay, thank you.
Any further questions from AM 800?
In regards to the outbreaks, I know this was asked, I believe, last week, and Dr. Alma at the time said he was looking into it. I'm not sure if anything came about, but the outbreaks at the long-term care and retirement home, I noticed it's staff members. Are these staff members that have refused to get the vaccine?
I don't know that if that is is accurate. I would have to look into that.
Okay, thank you. Have a good day.
Thanks.
Any further questions from CTV?
No, thank you.
CBC?
Yes, kind of a hypothetical question. What happens if you have COVID-19 and you don't know it and you get the vaccine? Would it still work, or would someone still get sick?
You could still get sick if you're incubating the vaccine or the infection, and you get vaccinated. You could still get COVID. So that's like even with the flu and but yes, you could still get it. The protection.
But after you were better, would you still most likely have immunity?
Well, you would have immunity you could have some from the vaccine, but also from the having the actual disease. But with the vaccine, it doesn't, the effectiveness is not immediate. So it will take up to 14 days for your body to have immune response. So it's not an immediate vaccination. You're protected. There's a time period there. So if you're already incubating the infection, you could get, you'll still get sick, and the vaccine won't have any effect on that. But, you will have some protection from the vaccine eventually.
Okay, thank you.
Any further questions from Blackburn?
No, thank you.
Windsor Star?
Just to clarify, Teresa, you said that if someone were to attempt to pre-register for the vaccine through the provincial registration form, they would be forwarded to the local form. They wouldn't be able to register through the provincial one by accident?
Not for the Windsor-Essex area. They will, when you go to the site, the provincial site, it'll redirect you to the local health unit site. And in our health unit, because we have our own booking and on-call center right now, it links you back to our site.
Okay, thank you.
Actually, Maureen, I did connect with the epidemiology team, and it's all vaccines. The numbers.
Oh, perfect. Okay, so that number, the 44,000, includes the AstraZeneca as well. That's great. Thanks, Mike.
Thanks, Mike.
Okay, thank you, everyone.
Thank you.
Thank you.